There are numerous benefits to engaging in early intervention for children who have been lead exposed and their families. I'm Pamela Epley, and I'm a clinical professor at Erikson Institute, a graduate school in early childhood development, education, and social work in Chicago, Illinois. I'm thrilled to be partnering with Illinois' Early Intervention Program and Legal Counsel for Health Justice to support the learning and development of children who have been lead exposed. Illinois' Early Intervention Program has been supporting infants and toddlers and their families for more than 30 years by providing therapies, parent education, and service coordination. During that time, early intervention has focused on supporting children who have developmental delays, as well as those who are likely to experience a delay in later childhood. More than 40 years of research has identified the effects of early childhood lead exposure on children's learning and development. Studies have consistently shown that even low levels of lead can lead to decreased IQ, attention, language, learning, memory, and lead exposure can also lead to impaired speech and hearing, decreased reading readiness, and increased incidence of ADHD and behavioral disorders. For many children, difficulties associated with lead exposure don't become apparent until they enter school. Over time, these challenges can lead to ongoing learning difficulties and academic struggles or failure in elementary, middle, high school, and beyond, as well as ongoing health and socialization problems. Increasing expectations for children as they enter school is a big reason why the effects of lead poisoning often don't show up immediately. In preschool, children are expected to sit quietly for periods of time, share with their peers, follow directions, and listen, attend, and remember what they've been told. In kindergarten and early elementary school, those expectations increase. Children must adjust to a longer and more structured day, understand and complete assignments and homework, work cooperatively with their peers, and acquire academic skills such as reading, doing math, and answering questions. For children who've been lead poisoned, these growing demands often create difficulties. Children who've been lead poisoned in early childhood are more likely to struggle and to be behind in reading and math, and they're also more likely to demonstrate challenging behaviors that can lead to school suspension. This is certainly not what we want for any children. Until recently, when children had elevated levels of lead in their system, doctors and public health professionals focused on reducing lead levels and preventing further exposure. These actions are critically important for young children, but what if we could do more? What if we could support children's development before they start to show the effects of lead poisoning? This is exactly what Illinois' Early Intervention Program is trying to do. Support children with lead poisoning to minimize their risk for later challenges. While many people know of early intervention as supports and services for infants and toddlers with developmental delays, early interventionists also focus on preventing and reducing delays later in childhood, which is exactly what many children with lead poisoning need. If your child has been exposed to lead and lead poisoning, early intervention can help. Early interventionists are experts in child development and have the knowledge and skills to support your child's development through everyday learning activities. They are also experts in supporting parents and caregivers. They do this by listening to your concerns and ideas and sharing their knowledge and expertise so that you and other caregivers in your child's life can work together to support your child's healthy development and decrease the chances of later difficulties related to lead poisoning. Professionals who may support you at early intervention include your service coordinator, speech, physical, occupational, and developmental therapists, social workers, nutritionists and dietitians, vision specialists, and others. In addition to providing therapeutic services, professionals are equipped with a service guidelines manual that contains a variety of lead poisoning prevention resources and supports for you and your family. Some of the resources they can provide you with include housekeeping tips to reduce lead hazards in the home, lead testing follow-up information, nutrition recommendations and information on WIC and other public health benefits, information on your rights as a tenant, information on sources of lead, services available from your local health department, and school enrollment and child care information. Early intervention services will help support your young child's growth and development so that their lead exposure never impacts their ability to learn, grow, play, and thrive.